Nothing on the Bonnell Foundation's Living with Cystic Fibrosis podcast should be considered medical advice. Medical advice can only come from your CF physician. Cystic fibrosis can be a devastating diagnosis, but living with the disease can bring positivity and a new appreciation for each day. From the Bonnell Foundation in Detroit, Michigan, it's the Living with Cystic Fibrosis podcast, sponsored by Vertex Pharmaceutical and Viatris. Here's your host, Laura Bonnell.
The Bonnell Foundation continues to raise awareness about cystic fibrosis and that anyone can be born with the disease. Dr. Johanna Zea-Hernandez joins us today, and she is a pediatrician pulmonologist in Grand Rapids, Michigan. Dr. Zea-Hernandez is a board-certified pediatrician specializing in pulmonology. She earned her medical degree from Universidad Nacional de Colombia School of Medicine in Bogotá, D.C., Colombia. She completed her pediatric residency at Mount Sinai School of Medicine, Elmhurst Hospital in Elmhurst, New York, and her pediatric pulmonology fellowship at the Children's Hospital of Montefiore in the Bronx, New York. And Dr. Zea-Hernandez's clinical interests include asthma, cystic fibrosis, and chronic lung disease. And she is practicing at Spectrum Health, as I said, in Grand Rapids. And we are delighted to talk to her. You will just learn so much and hopefully share this information and raise awareness amongst the entire population so that more and more people will be correctly diagnosed with cystic fibrosis. So it's wonderful to be able to finally talk with you. As I told you, the Bonnell Foundation is starting a Spanish-focused page on our website, Latinx Familia. So we're excited about that. And we thought it was really important to talk to you about the Hispanic community at your Grand Rapids clinic. We do see patients throughout the state of Michigan and across the country, but not very many. Is that correct?
That is right. Yes. We just have few patients at the hospital.
You know, with those patients that you see, were they diagnosed easily or were there stumbling blocks for their diagnosis?
Some of them were diagnosed easy through the newborn screen, some of them not, because of the type of mutations that they have.
What is the challenge with the newborn screening for people of color and that, which includes the Hispanic community?
I think one of the challenges is the type of mutations that they have. Those mutations are not very common. So not all of them are included in the newborn screen that we have. However, when they were doing in Michigan, when they started the newborn screen in 2007, what they did is try to take the most common mutations in the state and then make the panel. So we are looking for 60 different mutations. So we try to capture most of these populations. The other thing that is important is the pediatricians and how they do a wonderful job, like trying to capture those patients that we cannot. But most of the time we are able to get them in the newborn screen.
Is it that there are fewer people that are Hispanic that have CF, or is it just that they haven't been diagnosed at this time? Because it's pretty small. Do you have 4 patients?
We have 6 patients at the center. 6? Yes.
And how many patients do you have?
150.
150, correct?
Mm-hmm.
Yeah. And there was about 1,100 in the state of Michigan, and maybe 12 people are Hispanic.
Yes. But I think it's also related to the amount of Hispanic community that we have in Michigan. Then I think the other important thing is the diagnosis has increased a lot now. There is more awareness now. And we are in the month of the awareness. So I think that this is really important what we are doing in the community to create that for the pediatricians to check on those common things. We get a lot of referrals, not just for the Hispanic community, but for many other patients of pediatricians that think that cystic fibrosis could be a possible diagnosis. So I think that's where the role of our community and our pediatricians is wonderful.
And we are going to talk more about the pediatricians, but I just also wanted to stick with the newborn screening. So they do test for 60 on the panel, but there's 2,000 different mutations. And I know with my daughters being 27 and 24, I think and that isn't that long ago, but it's been viewed wrongly as a Caucasian disease for so long. And I certainly hope that's changing, because there are so many people that go on being misdiagnosed that maybe still aren't diagnosed, because like my kids didn't even benefit from newborn screening. We didn't know we were carriers. So do you have any idea of how many people in Michigan or even across the country might not be diagnosed? Or I guess what I'm asking is, how big do you think the CF population is in the Hispanic community, or could be?
I think it's going to depend on like where do they live, and like areas that are more like Hispanic, like where they have more Hispanic population, they have a higher incidence of cystic fibrosis, just because of the same things. The genes that they are like checking are more because the population is more. So I think that could be playing a role. But with the newborn screen, like being in all of the states, I think that is really important, because they are doing, I feel that that's the main job that we have, like to keep looking for these patients that are positive, although you don't have a mutation. Sometimes it's very rare, but sometimes we get in our centers patients that have a high IRT. That's why we are checking in the newborn screen. Even without mutations, if it is really high, like that's a concern for us. So although the patient didn't test positive for any of the mutations, I think we need to check for that, because it's not normal. That doesn't happen a lot, but it's very, very rare. Like we have seen like maybe 2 or 3 cases. But I think that the job that we are doing with that is great. That has changed the diagnosis and early treatment of all the patients. One thing that I wanted to mention is also the Cystic Fibrosis Foundation is working really hard on that. And now that we are more aware of like diversity and resources and everything, we are checking on that. We are part of the Cystic Fibrosis Learning Network. And we were talking about that, like how do we give more like diagnosis, resources, treatments to these patients that are a minority in our population. So that is what is making the difference for our patients, because we are aware. So we are working on that. The Cystic Fibrosis Foundation is working on more therapy and like therapies for patients, like these 10% of like the minority of patients that don't have a treatment with the modulators. Mm-hmm. We are working on, like the Cystic Fibrosis Foundation is working on that, supporting that minority and trying to see and investing more and more support on trying to get treatments for that small 10% that has not been able to be started on therapy.
So maybe we don't know how big the population with CF is. Okay.
But I think we are doing a better job, because now that we are checking more and being more aware is where you start like finding more like early diagnosis. So I think that's important too.
Now, in your country of descent, where you were born in Bogotá, Colombia, is the population higher there, or is it higher in Miami, Florida? Do you know that? Is that what you were kind of referring to?
I think it will be more in Miami, Florida, because the research says we don't have cystic fibrosis as part of the newborn screen in my country. So as I say, that is what makes the difference. So yes, it will be higher in Miami compared to other places, just because of the diagnostics part.
And in Colombia, I don't know if it's like Egypt, where they really officially haven't said that cystic fibrosis even exists in Egypt. Do they not admit that it exists in Colombia either?
No, it exists. And There are centers of cystic fibrosis there, although it's not easy to diagnose because of many like barriers that we can have. There are centers. I was trying to work with one of the centers there in Bogotá to try to bring more resources and tools because of the challenges that you can have with the diagnosis. Like, we are very lucky here that we have a great newborn screen system, and we have sweat tests that is like we do it every time with all our patients that get referred, and is very accurate and easy to do. So for us, it's something that we see every day, that we say, oh yes, this is the gold standard. We do it and really easy to access. In Colombia, that's one of the challenges that we have. Is this the test? Is this accurate, the test that we are doing? Do we have the right technology to do it? Another thing that is challenging is the testing of the mutations. We don't have, it's not as easy as here when we have a patient that is positive and then you decide to send the genetic test to look for more mutations. That part for us is easy, and the insurance is covering that. In Colombia, we don't have that fast. There are few mutations that can be tested there. If you need to send something more advanced, then sometimes we have to send it here. So those are challenges that we encounter in Latin America, at least in my country, for what I have talked and what I have seen. But I was there many years ago, but we lived through that with my family, the challenge of diagnosis. And that's why put me here, working with families with cystic fibrosis and challenging patients, because we lived through that and it was very hard for us to get to a diagnosis. And that's why we still see it has been better, it's getting better, but it's still a challenge.
And when you say you lived through that, did you live through that as a doctor, or is cystic fibrosis in your family?
It was my uncle who had bronchiectasis. He was sick. He passed away 12 years ago, and we didn't know why. And I started learning more, reading more. It was a challenge for me to try to find out why he had bronchiectasis, why he had pseudomonas, why he was so sick and with so many admissions to the hospital. So then that's what brought me here. To read about his disease, to read about pulmonary exacerbations. And then in my mind, I was always thinking he has cystic fibrosis or primary ciliary dyskinesia. I always was looking for those things. We had to send the genetic test here to United States at that time. And we never found out why. And unfortunately, he passed away and we never found out why. But in my family, I was the only doctor. And then it was challenging because I felt that many pieces were loose with the communications with the doctors and talking to my family in terms that they could understand, in an easy way, because it's already challenging. And families with cystic fibrosis, it's already challenging to try to tell you that your child is sick. And now explaining to you in your language all the things that are complex that are happening around that diagnosis. And I think that's one of the things that for here in Michigan, I think that is so important to try to connect with the family and to explain to them in an easy way for them to understand what is happening.
So did you do any genetic testing with your family? I'm just curious because I wonder, that would be interesting if you had that disease tie.
We didn't. We did it on his son because his son was sick also when he was younger, but he's better now. But we did it with him, but nobody else.
Wow.
Because it's challenging. It's not an easy access. And if you can do it, it's very expensive. So then those are the challenges that we encounter there.
But I think it's wonderful that as a doctor and a family member, you had this curiosity and it brought you here to the United States. So how long have you been here, and have you been in the cystic fibrosis community, as a doctor? And how has it, opened your eyes or changed your life?
Wow. So I came here 16 years ago to do my pediatric residency and then the fellowship. I started to work closely with cystic fibrosis at Health in the West. That was 6 years ago. And having my personal experience with my family always have encouraged me to help the Latin American community, to communicate better, not just cystic fibrosis, but every single patient in the clinic, just because I feel that talking in your language opens more things that sometimes the families are not able to communicate. And then with cystic fibrosis, yes, 6 years. I have been working 6 years with the CF community. It has been great. I always try to do my best to be on their shoes. Like, what are you feeling? I want to communicate as much as I can and try to help them, because there are many barriers. And I can imagine all the things that are happening around, like your family know just one member, but the whole family is affected. So I love working with CF patients and with CF families.
And some of what you touched on is one of the barriers for diagnosis: language, where you live. It's your socioeconomic status, right? Because can you get help? Can you find a doctor? Newborn screening, will your mutation be diagnosed? And then back to the pediatrician, where they hopefully diagnose you, right?
Yes. It's all the ones that you mentioned. And I think about that. Like, okay, did you screen positive? Then maybe no. How often are you following up with your pediatrician to learn, first, what are we looking for? And second, how often are you doing it? Because sometimes the socioeconomic part plays a role. Is transportation an issue? Can you get to your pediatrician? Can you get to the hospital when they are sick? Sometimes no, sometimes there are not. Do you know how to get the resources to get through that? And that is important. Like, that's part of what we teach our families. We are here to help you. We are here because we can teach you what are the resources, because sometimes we don't know that. And they don't know that. Like, they don't know that they can have transportation that you can like just call and they will go and get you. But then also, like, you have a job, yes? And you cannot call many times, because then you won't have a job if you are
Right.
calling all the time. So I think those barriers are really important. And the cultural part, I feel that when we talk to our families, many times I get, not just from our CF patients, but in general, the Latin American population. Sometimes the patients tell me, but you know that in our countries, you know that in our culture, we do this. And that connection and trust is so important if you can build that with your families, because that is going to open many other good things with them. The trust that they can have to tell you what they are feeling. When I talk to them, they start telling me everything that is happening. And I think that that is like life-changing for them. If I can get that trust and we can get that connection, and then help them to trust me, to call me with any simple questions. I always tell them that, call me if you don't know, because sometimes as a parent, you are like, yes or no, just call us. We are here to help.
Right. They must be thrilled to have you, because it's such a comfort. I have to give you a quick example. You know, in England, they're speaking English. Yes, they have a British accent, but they're speaking English. And yet we still had a communications problem, because when Molly, my oldest, had a CF exacerbation, it was before the pandemic, and she said, Mom, I've got this. Don't fly out. I'm going to handle this myself. And I kept saying to her, are they going to give you a PICC line? And she said, I keep asking if they're going to give me a PICC line, and they don't know what I'm talking about. So they said no. And then the next day they said, all right, we're taking you in. It's called a long line in the UK. I mean, and we're speaking the same language. So I can't imagine speaking a different language and hoping that you can all communicate correctly on such major issues. I mean, it was just a different word for a PICC line that we use here that, you know, that there is a barrier about. So that's just so important. And what if everyone doesn't have, you know, a Dr. Zea-Hernandez? Do most clinics now have interpreters, or? Yes. Okay.
And I think that is so important. We have interpreters on the phone, and we tell, like, I always tell my patients, don't hesitate to call us, because one of the barriers is that I feel that if you're calling and then you say, but what if they don't understand what I'm saying? So I always tell them, like, we have interpreters on the phone. We can call you back with an interpreter to help you. And then we have interpreters on the clinic. We have in person, which we really like, and we try to do our best to have in person. for our cystic fibrosis families. And then if by any chance there is no one available, like during the pandemic, we had some limitations. That's better now. Now we have the iPad where we can have access to interpreters all the time.
What do you think the biggest barrier is? I mean, we've talked about everything, but is it language or is it the Hispanic community just getting access to information?
I feel more language, or maybe access, but I feel that if you are having symptoms, that's where we play an important role. Like we get a lot of referrals for that. So we try to be really good at like giving you the information and things to look for. I think that, and language, we provide that. I feel that is more like all the patients need to know we can always ask for that on the phone, in person. We are here to help you, like to provide the best care. So I think both of them are important.
What would you say is the best way to get the word out to the Hispanic community? I mean, I told you we're trying to add a page on our website that's in Spanish. It will be helpful, but we're still not, I guess, in the community in the same way that you might be in the community. So how do we do better in connecting with the Hispanic community?
I think through the pediatricians. I feel that they are a great help for us. They have a close relationship with the families. They see them more than anybody else. So I feel that will be a very important place to start. Now, if we can later go to schools maybe and then create that awareness, like you talk to families sometimes and say, like, to other families, with cystic fibrosis, but sometimes I ask when I am discussing what are the possibilities that I'm thinking, I say, have you ever heard about cystic fibrosis? And they say no. So I think that just creating that awareness with our pediatricians' offices will be a good way to start.
Yeah, that is great. And then when you are dealing with your patients, working with your patients, is there any difference in dealing with the CF population just based on if you're a person of color or you're not? I mean, it's all the same symptoms and the same care. So maybe there's a family structure that's different, that's even more helpful because you have, grandparents living there as well. I don't know. Is there anything just to raise awareness about how we can better embrace and help the Hispanic community?
I feel that all the families are similar. When we are treating the families, regardless of the race, everybody is the same. We just have to accommodate to every specific family. Every family structure, regardless of your color, is different. So we just have to create that connection with the family and try to see how can I help you? How can I help your family the way that your family is? That's so important for us. We all try to meet the families because that way, we are aware of what is happening and we can provide the best care. Even if you are seeing Dr. Miller or Dr. Schuen or Dr. Zea-Hernandez, it doesn't matter. We are trying to provide the best care for your family.
And I would think, too, I know if I talked to a CF mom in the Hispanic community, we would have exactly the same fears, the same worries, the same concerns. We'd have the same laugh, about things. And it's very interesting. And I'm so glad that more awareness is being raised about it.
Yeah. And I think your idea of having a website in Spanish, that can make a huge difference because you can read everything in your language. A lot of our families, when the babies are diagnosed, they don't speak English, but as the time goes on, you are in the clinic all the time. You are hearing the same terms over and over again that you learn it. But I feel that reading something in your language can make a huge difference. And then you want to read more about it because it's easier for you to understand.
Absolutely. And on the medications, I do see, and hopefully it's for all the medications, but it is also written in Spanish if you're getting like a Pulmozyme or a, whatever drug it is, or if you're using a vest. I mean, the directions are also in Spanish.
Yeah, most of the things come now in both languages or more.
So are you seeing that more families are being diagnosed because everyone is making more of an effort to raise awareness, in the Hispanic community?
We have not had a lot of recent Hispanic babies that are diagnosed. And I think that what made the difference in the diagnosis was the newborn screen. That is where you saw like the big change. Now we are seeing more of these like positive screening, and then we are getting more of these babies that are positive in the newborn screen, but not necessarily positive with CF. But we are screening more, and I think that makes a difference because you have less chances of missing something important.
And then to the pediatric doctors, is there more education going toward them to say, hey, pay attention, remember what the red flags are for cystic fibrosis? Or does there need to be more education done amongst them? Because I still hear a lot of misdiagnosis going on for CF by pediatricians.
I feel that they are like, our pediatricians in the community are great. We get a lot of referrals like of concerns. We also see a lot of sweat tests. Even if they are not referring the patients to us, they do a sweat test because they are concerned. So I think that for what I have seen, our pediatricians are pretty good, like trying to screen for that. Of course, it's never a bad idea to give an update because many things have changed in the CF diagnosis. We are doing more research. So I think that everybody needs an update, like what is happening. So I think that will be a place where you say, okay, this is the update. But I feel that most of the things in diagnosis of like, what are you looking for? They really know like what they have to look for. It's more of like the new treatments just to show everybody all the amazing things that are happening.
And as a doctor, what are you happy about? What do you see when you look at the Hispanic community being diagnosed with cystic fibrosis? Are you seeing that they're getting the care and the information that they need?
Yes, they get the care that they need. As I say, we really work hard to provide everything for everybody, not just for the Hispanic community, but for everybody. We work really hard to provide the multidisciplinary approach and then to communicate with them and support them through the whole process.
Is there more that we need to do, or do you think we're on our way?
I think we're on our way, but I feel that always there is more than we can learn and do. So I always say, like, if somebody has any ideas of things that we can do, we are part of the CF Learning Network. That is a quality improvement initiative around the United States to work as a group with all the hospitals, many hospitals. We are part of that. And then we are trying to see what can we do to make it better? What is a challenge? How can we make it better? So I think that there is always room to do more and more.
And what are you hearing from your families who are Hispanic and have cystic fibrosis? What are you hearing? Kind of what feedback are you getting from them as far as, hey, this worked great, or I found this information here, or something that didn't work well? Are they giving you feedback as well?
We try to get feedback, and that's part of the survey that we send. We love to hear feedback. We are planning to start a survey talking about equity. We are planning to start a survey to see what can we make better. How can we make it better? How can we help? Because we don't see many things that you can see at your house. Like sometimes you think, oh, this will be great if they can help me with this. I don't know with what, because every family is different. Every situation is different. So we want the families to tell us, how can we make it better? So that's one of the things that we are starting, because we want to see what could be challenging for your house? And then, is there any way that we can help you? I think that's really important. And we are being more aware of we need to look for more things. We want to make it even better. Always. There is always room to learn more and to do more.
And I think one of the great things that helps me is I'm so connected to so many CF moms, some CF dads as well, but throughout whatever clinic they're in, are they able to connect to other families in other clinics so they can speak the same language?
We facilitate, let's say we have a new diagnosis. We ask other mothers, could you please talk to this family? I think that makes a big difference because, as you say, you have the same fears, you have the same thoughts. So I think that is really important to make that connection. We ask our families to connect if possible. I know there is a group of parents that get together and then they share their thoughts. So I think that makes a difference for them too.
Yeah, that's got to make a huge difference. You just have so many things in common. And like I said, the same worries and concerns. Tell us what your hope is for the future of CF, what you're excited about, and what you're seeing as the CF world continues to grow, and kind of what your hopes are.
So my excitement is with all the changes that we have seen with the modulators. It's amazing what we have seen, just to see how we have less admissions. We have patients that were coughing every day, and then suddenly they come and tell you, I am not coughing anymore. I can't believe it. And this is thanks to the modulators. And then we are looking into more ways to try to keep working. We really need all the treatments. I know our families are tired of doing many things. So I think that all of these things that we are doing, part of all the research, is amazing. And I am very happy to see that, just to see my patients be different. The quality of life is different. The pulmonary functions going up, the weight going up, all of that I think is amazing. And then I know with the support of the Cystic Fibrosis Foundation, this is going to be better and better. And this a small percentage of patients, that is a huge percentage for us because yes, it's 10%, but we want the treatment for everybody, right, for the 100% of the patients. So I think that we are going through that direction with all the genetic testing, genetic therapy, and all the things that they are doing. If you see, it has been faster and faster. Our first modulator came in 2012, but then between the last two is just 1 year. So 2019, we are already seeing all this amazing difference. So I think that we just keep working and we will see that soon. I am very positive about that.
I am so hopeful about that. Yes, because I don't know if I mentioned it, but I have one daughter who can take the triple combo modulator drug and one who cannot. So she falls into that 10%. So yes, it's so important that everyone can get on this drug that changes the underlying condition of CF and just makes them so much healthier. It's fantastic. How would you like to end this podcast as far as your hopes for the Hispanic community as it relates to cystic fibrosis?
I would like to tell our patients that we are here for you. Please be sure that we're going to provide the best care that we can. We want you to talk to us. We want you to not hesitate to call us anytime. We want to provide the best resources. And please tell us if there is anything that we can do to make it better. I think that is really important for us. Tell us if we can change something or we can add something that you think that can help other families too.
Absolutely. And you will also, you'll have to share with them our website page too. As soon as it goes live, it's going live about the time this podcast comes out, but it will be a great way to connect. We have, Hispanic influencers, from social media on there and information. So I'm really excited about that too.
Yes, I think that that's wonderful. Just to be able, and we will share that with our families for sure. And then not just with the CF families, I feel that with everybody, we want to create awareness. We want to share that with everybody. So if everybody's aware, then that is going to bring more diagnosis because you are thinking more about that.
Absolutely. Great point. And thank you so much, Dr. Zea-Hernandez. I'm so glad that you came from Bogotá, Colombia to share your expertise and your knowledge and help the CF community in general and the Hispanic community. We're so lucky to have you in Grand Rapids. Thank you.
Thank you very much for having me here. It's a privilege to be here. And thank you for everything that you are doing for all the CF patients and for the Hispanic community. I think that is amazing, and you will help so many families.
Thank you.
The original music in this podcast is performed by Kevin Allen.
It's not complicated.
Who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, visit our website at thebonnellfoundation.org. That's the BONNELL Foundation.org. This podcast was sponsored by Vertex Pharmaceutical, The Science of Possibility, and Viatris. It was produced by Jag and Detroit Podcasts. Follow our show in Apple Podcasts, Spotify, or wherever you're listening right now.